Why do patients seek healthcare? In other words, what do they want from their healthcare professionals? A general assumption is that patients want an accurate diagnosis and quality treatment. But research shows that that's only half of the patient's agenda. What patients want from their healthcare professional is an accurate diagnosis and competent and appropriate treatment, and also relief of fear and anxiety that accompanies illness. I'm Dr. Carmelina Darrow. I'm a general dentist in Wilmington, Delaware, and I asked 3 of my patients to answer the question, what helps you deal with medical and dental treatment? Let's listen to what they had to say.
My grandmother knew my fear, so she lied to me about where I was going because the dentist was in a building in New York. It wasn't a dentist's office. I was picked up, put in a chair, literally held down. My arms were held down. And they didn't fix teeth. I only had a little, like a hole in the front tooth right here. And they didn't do that then. So they ripped out my 4 front teeth. And I was like, I forget how old I was, 9, 10, I was young. And from then till all my life, I never had 4 front teeth. And I hid it and I hid it and I hid it. The fear that I went through all my life, always thought about going to a dentist. I had an offer, believe it or not, for modeling. And I went to have pictures done. And then they asked me to smile, I couldn't. And just carried on through my whole life.
Yeah.
And all my life until I got cancer. And then I had no choice. They couldn't do the treatments without them ripping out all my teeth at that point.
On October 23rd, 2005, I was living in Florida, and through Hurricane Wilma, young and foolish, instead of evacuating, I decided to go to a hurricane party, and I sat down on a railing and slipped and fell 4 stories. Shattered my femur in 34 pieces, and my spine split to a Y. I was stuck to a wheelchair for 2.5 years, and then physical therapy, the support of family and friends. And by the grace of God, I was able to walk. I remember I was told that I wouldn't be able to have children. I had my daughter at 38, and just being able to navigate that through the help of, medicine, through the help of therapy, a little bit of mental health, and then the love and support of your loved ones. I think that all these combinations made the right concoction for me to recover.
When I was younger, I was really okay with getting dental work done or even the injections. And I don't know, somewhere along the line, I guess I ran into some service that was kind of a little more brutal, and I became cowardly in my old age. And what I appreciated with you was being able to verbalize that and work together in coming to terms with it. The things that got me were dealing with physical pain. I remember that when we started, the drilling was for me the most terrifying, I think. And I used to be kind of okay with it. So I don't know what's happened. I'm 71 now. I remember that when the drilling started, if I could feel anything, you were ready to stop and give me another injection, which you did. And I appreciated that. And you would describe what's going on. And then I also wanted to know, which you obliged wonderfully, was when you're nearing the end of the drilling, to tell me so that I could just kind of finally surrender to the end of the procedure.
Things today are very fast. Doctors want to get their patients in and out. They only have so much time for so many patients. And I think people understand that today. But when you come against somebody like myself, whether it's afraid of a dentist or a doctor, I think to ask first, what can I do for you? Not what's wrong with you, what's your symptoms, or of course you have to get that, too. But what can I do to make you feel comfortable? I'm not going to do anything without your permission. Doctors and the tests, they have control. We've got to have this done and you've got to have that done.
Yeah.
It's like you lose total control. And if you have a fear, that control, it overtakes you.
When it comes to the medical, not so much the dental area, surgeons sometimes are very straight to the point. This is what we're going to do. We're going to screw here, screw there, put this there, put that there, but forget about that specific component, the fear part. There was one doctor that, he was more technical in his approach, but then when it came to the other doctor, he was more kind of first said, take a breather. It's gonna be okay. It's not my first time doing this. So kind of making it a little bit more about me than the actual procedure.
I've had some experience where the doctors can be very brilliant, or in high positions in their hospital, and they don't tend to listen. Concerns that are maybe kind of like lightheartedly dismissed, or often dismissed, or just the sense that the doctor doesn't really want to spend any more time, and they seem distracted, curt, or impatient.
You were the only one that actually took the time and talked softly and didn't give orders, didn't give directions. You said, let's try this. And the thing I remember the most, lift your leg up. So you concentrate on something else. Lift your leg up, hold your leg up. That helped me a great deal.
A little distraction.
Yes.
Okay.
Yeah. It's hard unless you kind of get to know the person first a little. A small procedure first to get them to trust you, to get them to know you. I know that, like I said, they don't have time for this today. I know everything is rush. But I know that's what would make me feel comfortable. That they don't just throw everything out. Well, we got to do this and this and this, and this has got to be done. Unless it's an emergency, of course, like I said, and it has to be done. But just to get to know the person a little.
You were getting ready to take out one of my molders, and you first asked me to relax and walk with me, and gave me kind of a plan on how to do a little quick self-meditation through the process, which helped me. And then there were other techniques. You did this little thing, moving my jaw. I didn't even feel the needle. I really appreciated that. Through having that process, it let me kind of put my shoulders back, get comfortable in the chair, and you let me know that at any point through that process, if there was something, to just let you know. And those things make a difference. If everyone did that, I think that the recovery, the actual interaction will be more pleasant than the anxieties that we come in with.
I think the overall main thing was that you were willing to talk with me, the patient, about what would make me comfortable or uncomfortable. So I haven't had any other dentists who are as good at that as you. And when I tried to do that with some later work, it was partially successful, but I could tell that they weren't used to dealing with people like that. It wasn't control so much as working together. So I remember now that you said we should, if I went like this, that would mean stop and let me talk, you know.
Yeah.
So rather than interrupt or grunt or groan or cry or anything like that, I came up with a hand signal, and that worked beautifully.
For myself, I would hope that the person who's caring for me would ask questions like, what does it feel like to have this problem? Or what does it feel like to have this procedure? You know,
Those are two very good questions.
that would feel comfortable to you being
Yeah, absolutely. I never thought about that. That's excellent. I don't know how to teach or say how to get somebody, but if they could just think about that, okay, you're a doctor. What if you couldn't have went through school? What if you, a fear that you had, you could not accomplish that? And God, what if I couldn't have been a doctor? How could I help this person overcome this fear and be comfortable?
Yeah.
I've said before, if I could help one person, for them to accomplish as a young person and not ruin 60 years of their life, not ruin, but I mean just miss so much, that would make my life.
I think it's about the acknowledgement of the two people working together through this process. It's a relationship. In that moment, there's a rapport that has to be established of trust and being okay with one another, so that we can both, one, the doctor, the clinician, do what they need to, and two, for me to get the service and be able to be okay and not make it more complicated than it should be. Adding meditation skills or some type of interactive, I don't know if something that could be voluntary in the beginning, just to see how that trial will go, and what would be the success of people who experience this extra training. Because as clinicians, doctors, you have fears, you have also anxieties, and experience what that might do for you in that instant. So now you're able to see, if you were able to gain a little benefit from it, imagine when you give it to a client in a chair right before you're gonna drill in their mouth.
The approach that you have is already ideal, you know, because I think you're one of the best medical professionals that I've ever had the pleasure of working with, because you engage with me and the patient with a level of sensitivity and empathy that I haven't seen all the time. I think that it really is dependent on the personality of whatever medical professional is there. And I think what they call bedside manner is very important.
You know, like when you're sitting in the chair and you're terrified, what would you want somebody to do that would say empathy to you?
Well, first of all, they would have to recognize that the person might be fearful.
Yeah.
You know, you could point blank ask them, are you
Yeah.
okay? Are you comfortable? Are you nervous? What are you thinking? You know, that helped a lot was you were explaining what you were going to do, what the tools were, what the materials were, you know, and how you were going to put it in and stuff like that. I remember getting part of my teeth filled with this kind of porcelain, whatever it is, you know, and you were describing what that is. That's all extraordinarily helpful.
Why do you think that's helpful? Is it a control issue or just?
Well, just to know,
reframing it.
That's probably not going to hurt.
You know, the work that you do in those 45 minutes leaves with me. Training new people in, whether it's medicine, counseling, anything that is interactive with people, helping people, it's important to have the components of empathy, compassion, the knowledge of that specific field, but also knowing what happens once they leave, because it doesn't stop there. And if I'm able to say, hey, this doctor related to me, this doctor kind of walked me through this process, gave me a little control, especially when it comes to the dental arena, it's like, a lot of fear. That, I think, leaves a better taste in a client's mouth. And when they come back, it's not as fearful. They know that they're gonna take this journey with the doctor instead of the doctor doing something. It's something that becomes a mutual agreement.
To learn more about the meditation practices, communication skills, and interventions for procedural pain and anxiety that helped Mark, Nina, and Joy, check out the upcoming book, The Mindful Healthcare Professional, A Path to Provider Wellness and Patient-Centered Care. Thanks for watching.